What's up, everybody? I'm Brian Brosey, B.Well Physical Therapy and Wellness, co-host of the Wellman's podcast. I'm going to demo and kind of talk about the chin tuck here. And if you're working with me as a personal training or physical therapy patient or client, you'll know I've talked to you about kind of if you have a blood pressure cuff, using that as some form of biofeedback. I've also talked about it on a few podcast episodes. There is a device for craniocervical flexion testing. CCFT is the acronym for it. There's a little device like a blood pressure cuff specifically for this testing that you can use on the lumbar spine or the neck, the cervical spine, to use as a piece of biofeedback, and that's the purpose of the blood pressure cuff here. So if we don't have the blood pressure cuff, again, that's perfectly fine. We're going to do a form of self biofeedback, some self-awareness to make sure what we're doing during this chin tuck is adequately training the deep neck flexors, as opposed to some of those gross, larger muscles like the SCM, sternocleidomastoid muscle. So just to review that very quickly, the SCM is this rope-like muscle that goes from your clavicle up to your skull, essentially. And you can kind of grab it and feel it. If you look, let's say, to the right, your left SCM gets activated. You look to the left, your right SCM is getting activated. So you can kind of feel that. And what you want to do is not be activating that or have very, very limited or very, very little tension in that SCM muscle as you perform this exercise. So let's say you don't have the blood pressure cuff. I want you to use your hands as feedback, feeling that SCM muscle and making sure it stays nice and supple, because what you want to be doing is using the longus colli and longus capitis muscles. These are deep neck muscles that attach to the front of the cervical spine and help flex and bring that cervical curvature to a flatter position, right? So that's what we're training. We're training our ability to kind of keep our neck stable as well with this. So no blood pressure cuff, that's fine. You're going to use the self-feedback of feeling yourself on the SCM muscle, which I'll detail and kind of describe and demonstrate here like I just described a little bit. And then I'll demo as well with the biofeedback and kind of talk about the cuff. And then again, if you have nothing, perfectly fine. Set yourself up in a neutral neck position, giving yourself some sort of support. So in my instance, it's the blood pressure cuff. If you have nothing, you can use a pillow or a small towel roll. And what you want to do is you want to place the blood pressure cuff or the towel roll or the pillow in the cervical curvature right under kind of the C2 spinous process. So if we follow our occipital protuberance, feel a bump on the back of our skull, follow that down, we hit kind of like a divot, and then we feel our first or second vertebrae, but the first one we actually feel. And we're going to go basically right below and right into that groove. If I'm using the blood pressure cuff, I'm going to obviously inflate it and feel that it's nice and even to start, right? Just to make sure I've got it in good place. I'm going to inflate that. I'm not inflating it too much. I've just inflated it to about 20 degrees or 20 millimeters of mercury here of pressure. And what I want to do is I'm going to use that feedback. So I'm at 20 right now. I'm going to slowly and carefully tuck my chin, trying to not involve these gross muscles, until I get to 30 millimeters of mercury. So it's a very small contraction. I'm going to hold that contraction, 1, 2, 3, and relax. Retract my chin, hit that 30 millimeters of mercury mark. Again, we're not going too high, that's the point. We want to stay within 5 to 10, and relax. Squeeze or retract, and relax. If I don't have the blood pressure cuff, and I'm not able to get that feedback, no problem, right? I'm going to use those SCM muscles. I'm going to lay my head down. Ideally give myself some form of support in my neck just so I can lay a little bit more neutral. I'm going to just kind of lightly palpate those SCM muscles and try and relax best I can. Tuck my chin, form the same motion with about the same level of force, and relax. Feeling those SCM muscles, trying to make sure they stay supple, they stay as relaxed as possible and aren't too involved in flexing our head down. perform, you know, the hold isometric as directed in your home protocol, or however you and I kind of discussed it. And if you're just seeing this video, it's great to start with some prolonged endurance holds so you can develop the kind of mind-muscle connection to those two muscles, the longus capitis, longus colli, those deep neck flexors. And the biofeedback's important to help make sure you're training those smaller muscles that are ever so important, as opposed to using the gross or bigger muscles that we typically end up compensating with. And this is a great way, a blood pressure cuff is a great way to monitor it. If you look up CCFT, that craniocervical flexion testing, you will also see the device that I've mentioned, and that has specific markers for like lumbar and cervical spine to do a similar type of activation.